very much. I see we've got a number of people joining and want to just kick things off, keep everything on a timely manner. Good afternoon, and thank you very much for joining our special edition of MidTown Mornings in the afternoon. I'm Richard Barga, Vice President of Economic Development here at MidTown. We have a great presentation today for you regarding safety in the workplace around COVID. And before we get started, and for anyone not familiar with our work, MidTown Cleveland is the organization that's charged with leveraging a diverse set of assets to develop a dynamic neighborhood that really tries to unite city's downtown and innovation district. We provide services to members, stakeholders, businesses, residents, and others to create a connected and complete community. We facilitate conversations, make connections, address safety concerns, and try to help you achieve your goals. So please let us know how we can help if you have questions about our neighborhood. Additionally, we could not do this type of programming without our partners and sponsors at PNC Bank. For more than 160 years, PNC has been committed to providing clients with great service and powerful financial expertise to help them meet their financial goals. PNC is proud of their longstanding history of supporting communities, employees, and shareholders, and we're thankful for their continued support. At the end of June, we released a organization or business reopening survey where we heard overwhelmingly that we needed to do more programming around safety in the workplace regarding COVID-19. And today we are especially grateful to have presenters from university hospitals, Dr. Joan, Zoltanski, and Melissa Braskie. Dr. Zoltanski is the Chief Experience Officer for UH, overseeing 14 hospitals, 250 health centers, and more than 27,000 employees. She is an intensive care physician and currently works in the Division of Pediatrics at Rainbow Babies and Children's Hospital. She's also an assistant professor at Case Western Reserve. During COVID, specifically, she's been leading the team of healthcare subject matter experts who help employers sensibly return employees and customers to the workplace. So thank you today to Dr. Zoltanski. Along with her, presenting will be Melissa Braskie, who is the Environmental Health and Safety Director at UH. She joined UH in 2005 as the industrial hygienist and has a 15-year track record leading different teams in various sectors, including healthcare, manufacturing, and industrial settings. So thanks for listening to me ramble on, and I don't want to take up any more time. So without further ado, I'll turn the presentation over to our guests. If people have questions, we'll leave some time at the end and try to, if you want to type questions in through the chat function, that should be enabled for you to do so. Otherwise, thanks to everyone who has joined the webinar with us today. Dr. Zoltanski.
All right, well, good afternoon. Thanks for hosting us and welcoming us. We've been trying to get out into the community to share what we know. I was saying earlier before we kicked off that COVID is a particular challenge because there aren't many clear answers because we're all learning. And so we're trying to do our best to share the information that we have and to share some best practices, knowing that every situation is different, every situation is unique. So we'll kind of go through, and we've got a slide where we'll introduce ourselves. So if we could start our slides, please. We put up there's a legal disclaimer, but also it's something to help me remind myself to maybe just recap exactly what we said. We try to give the most up-to-date information as it stands, but if you're out there and you're listening to the media and in the community, you know that this information is changing. I used to say weekly, then it went to daily, and I think sometimes it's hourly. So it's the most up-to-date information, but again, every situation is different, every organization is different, so you'd want to work within, of course, your own parameters and make your decisions based on what your own unique circumstances are. So thank you. We'll go to the next slide, please. One more, and one more after that. And so I will introduce myself and then my colleague Melissa Braskie will do the same after. But I have been working during this time of COVID with a group of university hospital subject matter experts. Melissa is one of them, because from the very beginning, what happened is the community was reaching out to the hospital system to ask questions and to say, what is this and how do we conduct business and how do we clean for this and how do we protect our employees? And we did a lot of listening and tried to help many businesses and still are, one-on-one. But we also quickly realized that this information needs to be out into the community as much as we possibly can. With that caveat, like I said earlier, is the information changes so frequently. Usually we like to have information that we put out that we know is going to be rock solid for some period of time. But what we're trying to do is really turn this quickly, listen to the community, see what the needs are, but also try to point businesses, employers, organizations to trusted resources so that they can make sense of the vast amount of information that's out there. So really to try to point to trusted resources, and then also to try to give some practical examples of what this may look like in your workplace. So to try to do those couple of things. But this group consists of our infectious disease doctors, doctors that we call infection control doctors, and Melissa Braskie, again, she will tell you a little bit in a minute, but what they have a big focus on is controlling infectious disease within our own facilities. So between employees, between patients within our own facilities, that's a big area of focus. And so as you, I'm sure, know by now, that's a big source of need in the community around COVID as well. So also information from our pathologists, so experts in testing that we've included in our work and what we're trying to get with the outreach. And then also operations. So how are we trying to conduct business? How are we forecasting volumes and revenue and all those kinds of things that a business has to do during the times of COVID? So we'll get into that in a little more detail, but that's some of the background that I've been doing with the UH team in the community. And then Melissa, could you share what you've been up to?
Sure. A little bit of industrial hygiene. And for those of you who don't know what that has nothing to do with dental hygiene or equipment. So an industrial hygienist is somebody who anticipates, evaluates, and assesses the environment and indoor air quality, chemicals, and then physical stressors such as heat, noise, and that kind of stuff. And I also oversee emergency preparedness at Cleveland Medical Center. So I've been working a lot in our incident command center in assisting with managing the incident from a safety perspective. And as I go through these consultations with reopening plans, I try to help out in areas with cleaning and hygiene and air quality.
So we thought we'd talk just briefly about, what we're thinking and what we're talking to employers about. And I know that there is a chat function. So as we go along, if you have questions, I'll try to watch that chat function and see if we can answer some of your questions along the way. But kind of give you an idea, as we know, the country, there's been an uptick in the country recently. And Ohio has had an uptick, but actually is staying pretty steady, which is good. So somewhat of an uptick, but certainly not what we're seeing in, of course, regions like Florida, but still we're hoping that we still can slow that curve as much as possible. And one of the things that we are what I'm going to try to do again is highlight some of the questions that we've been getting from employers and businesses and some of the things to think about. And one of the biggest things that we're talking about are the implications for flu season. And so flu season is coming up in the fall and throughout the winter. And we don't know what that flu season is going to look like. Some flu seasons are worse than others. But we all worry about this confluence of when the flu season is here and COVID is here. And so we're talking to employers, schools, community organizations about encouraging people to think about their flu vaccines and getting ahead of that. So talking to your employees about the importance of flu vaccines and why that's important to think about ahead of time. It will not be the magic cure for discerning when a disease is flu and not flu, but still anything that we can help, because when you look at the symptoms of flu, you're talking about fevers, some of the cold symptoms that you can get with the flu, those types of things. Those are the things that can be the same symptoms as COVID. And so until an employer is sure, until your school is sure, until you are sure, people are asked to, of course, stay out of circulation and to quarantine until that's the case, or to isolate if that's suspected. So that's why we're really talking about this and hoping that people will get ahead this year of thinking about their flu vaccines and getting their flu vaccines, and employers supporting their employees to get that flu vaccine. And again, we know it's not perfect, but anything that we can do to help is important. So we go to that next slide, please. And so, I said that we've been working with a number of businesses throughout this time, employers, nonprofits, convener organizations, Chamber of Commerce, really so many different types of organizations. And again, the way that came about is there was a big outreach to our organization from the community. They were reaching out to us to try to help them understand, to try to understand what best practices were. And we quickly realized that we were talking to a lot of people and really trying to put together some thoughtful work to help, but we really wanted to put together content materials that was available to the entire community. So not just the people that we happen to know, the businesses that we happen to be working with, but really we wanted to make sure that our content was free and available to the entire community. So in all of the businesses that we've been working with, schools, K through 12, higher education, we work to take that need, that content, and we have on our website, and I'm not sure if we will come up upon it later in the slides, but on our website at uhhospitals.org, there are a couple places where you can go to download this information. So uhhospitals.org/healthyrestart. And then yesterday we released our schools content, which also has a lot of information that could be applicable to businesses as well around cleaning and HVAC and all those types of things. And that's www.universityhospitals.org school playbook. So those are two of the resources that we have where we have pretty comprehensive information about getting back into public spaces. So again, working with a lot of businesses, but really wanted to also take our knowledge and what we were learning from working with businesses, employers, nonprofits, education, and make it available to everyone, because we really are doing this to try to slow the spread in the community. There are services that we have that you'll find on our website for some organizations are interested in really doing a deep dive on things like their back to work plans, on their unique situations. And those are things where we have services to tailor them to the individual organization. And that is found also on our website, on the Healthy Restart website on universityhospitals.org. If you go to the next one, please. And this is saying earlier about our subject matter experts. I put that up there. We talked about them a little bit, but to give you that kind of the breadth and depth of people who are involved in this, and then many people who are not pictured here, who are thinking about all of the safety measures in the system. Next slide, please. And there are a couple of different ways. So that, again, a lot of information out there, a lot of needs out there, but I always try to simplify the information. I think we can't digest it if it's all over the place, and if there are so many things that we have to look at. So I really try to think about this, and what we were hearing, we're really in 3 different verticals from what we were hearing from the community. They wanted information from our experts to try to help them keep their people safe. So to help keep their employees safe, to help keep their customers safe, to help keep their students safe. So a lot around personal safety of the people who are in their public spaces. And so that was a lot around screening and what is the screening process. The governor has certainly given some orders around employee screens and what that should look like. And so we have put up on our website what our screening questions are for use by the community, what we're asking people, what our process is, what our temperature cutoff is, many of those, that type of information. Information on there around, personal safety, around, food and break rooms, those types of things. And then also keeping the workplace safe itself. So keeping the physical environment. And that's where certainly Melissa and her team and many other places have been very helpful in making recommendations around cleaning, EPA cleaners, those types of things that we'll talk about in a little bit. And then also how to keep the equipment that employees, that customers use safe, and doing our best to try to remove germs from that, the virus from that. And then also importantly, especially from the executive leadership, people that are owning the businesses, is they want information on how to build trust and maintain that trust with their own employees and their own customers. And so what we have in our system, we stand up whenever there is a crisis, we stand up a crisis team. And that crisis team works to every single day transparently share information, share what we know, and transparently share with our organization what we don't know, which is very important. So, and I think what's especially challenging in this is in this building trust section with your employees and with your customers is people want answers. They want definitive answers that are going to stick. And as I said at the opener, there really aren't any right now. There aren't answers where we can say, schools is a great example right now. This is what's going to happen in the fall. It's day by day and things change, but people want answers, and leaders, people that have these businesses, want to give answers. They want to give that feeling of trust. But what we're encouraging organizations and leaders to do is transparently share what you know and also what you don't know, that this information will be changing over time, that it's not, here's your answer and this is going to be the same in 2 months, a month, a week, because it just changes so frequently. So the best way to do that when you don't have answers is to communicate frequently, to let people know every single day that you're working on it, and that they will hear from you as things change. Next slide, please. In our playbooks that you can download, down the bottom there you see the website, but in our playbooks you can download this information. There is signage in there that you can download for your own organization to print out to use if you want. But of course, one of the hottest topics in the US is masking. This is, you may have seen something similar to this, but this is our version of the reason why we mask, is in part to protect myself, but also in large part to protect others. So if I were to be ill and not have symptoms yet, that is what we call source control. So to wear that mask for source control, that's a way of taking care of others in the community. And that's why we in our organization have a masking policy. So you have to share the information with people and then follow it up with the policy in your own organization to make sure that that's happening. And then also on there on the right, what are the correct ways to put on a mask and take off a mask? So people want to be sure that they're taking it off the right way, in some way that helps keep the mask from contaminating their hands. So washing their hands before they put it on, putting it on the right way, and washing their hands after they put that on. So next slide, please. And then also, again, we talked about those 3 verticals at the beginning of how we were trying to put information together. And this is one that we like a lot in our own organization, around best practices, because it stood the test of time, and that's a hard thing to do in COVID. But since the beginning of COVID, we have used a phrase in our own organization on how to simplify the information, and what we should be doing, what are the best practices. So you see in all those images there's masks. So masking is of course something that should be happening every day with all your team members, but we say screen, clean, and 6 feet in between. And those are really the layers of this. And so there's the layer of masking you see in every image, and then there's the screening. What is the screening that you're doing for your employees? What is the screening the employees are required to do before they come in to monitor their health symptoms so that they are not coming in with symptoms? There is the cleaning process. So what is the cleaning of your facilities? But then also, what is my own personal cleaning? What's in that version for me is my hand hygiene. So what's the cleaning process? And then the 6 feet in between is the physical distancing parameters, and what that looks like in your own organization. So again, that masking, which you see in every image, but the screen, clean, and the 6 feet in between are really the 4 layers. When we put out our school's content, we reconfigured this somewhat, but the principles were really the same. These 4 big principles, we put them in ABCDs because that seemed more school friendly, but they were really these same 4 principles, and everything that we do is built off of these 4 principles. These are the big principles. Next slide, please. So in this here, Melissa, I don't know if you want to go through and talk about some of the physical distancing guidance that we have here and how that looks in the workplace.
Sure. So we try to keep 6 feet apart at minimum, but if you can go further than 6 feet apart, the further distance apart you get, the better. And in situations where you have workstations that are across from each other, you want to make sure you have a barrier, or if you can, checkerboard the seating so that employees aren't directly across from each other. But if not, plexiglass I know is probably on shortage right now. So try to find some type of barrier. If you don't need to see that person, it doesn't have to be clear, then you could use other types of materials. Let's see, employees are able to attend digital and virtual meetings rather than in-person meetings. So if you can allow employees to work from home or stagger their work schedules, having different shifts like morning and afternoon, or alternating days, have half your workforce come in on Monday, Tuesday, and the other half Wednesday, Thursday, those types of schedules. When we get to situations where we have common spaces where there could be a lot of people congregating, such as cafeterias, you want to remove chairs where people would tend to congregate, because if you stack them up and put them in a corner, they'll likely pull them out and still use them. So it takes some time, but you know, eventually after some policing, you can get to the place that you need to be. In cafeterias, you want to do grab and go. We've done away with salad bars and hot food bars and have more packaged foods now, as well as packaged utensils. Also touchless payment at the cashiers and cafeterias. Other areas where there's congregation or a lot of people gathering in small spaces are conference rooms. So posting occupancy limits on the conference room doors. So if you've had typical conference rooms that have had 15 people in them, you might want to reduce that by half, as long as you can still get 6 feet distance in between. And then one-way pathways are a good thing to do to avoid people from crossing paths or in areas where they might be congregating, like elevator lobbies where you have entryways into offices and exits. And then signage is also important, just to remind people. And I think that covers the physical distancing aspect. Can we go to the next slide?
Hey, Melissa, can I ask you on that last slide before you go, one of our favorite topics about masking at the cubes. What do you have to do? It's a frequent topic.
Yes, we encourage masking in the workplace. The only time that we say that you should remove your mask is if you're in an office by yourself with the door shut, or if you're eating, but we do not encourage eating in the workplace, especially in shared spaces. So as long as the weather is nice, we encourage people to go outside to eat. Otherwise, going to the cafeteria in a place where you can really get that 6 foot in between distance. So if you're eating in your workplace and it's shared space, that time where you're unmasked in eating, which is a high risk activity, you know, you're generating a lot of saliva for digestion. So it's a high risk activity and you're unmasked. And then maybe the next employee is unmasked 10 minutes later. That adds up to an accumulation, you know, it could be several hours of unmasking. Whereas if you go to a cafeteria, you're only there for your 10 minutes when you're eating.
And in the workplaces that we see, the smaller the operation, the smaller the break room. So I'd be very conscious of your break rooms and limiting the number of people in those break rooms where people are eating together with their masks off. I mean, of course, you're going to eat with your mask off, but they have their masks off eating, so limiting the number in there. And then as Melissa said, at the cubes, that is still an area where you have to mask. People sometimes think if they're in cubes that they're in a cube and they don't have to mask if they're distant. So it's not 6 feet or masks, it's 6 feet and masks.
Yes, and I saw a question in the chat box. Yes, masks stay on unless you are in an office with the door shut, and that's by yourself. So disinfecting, we recommend making a high touch list and walking through it with your cleaning staff, just so that you are on the same page and understand and agree on what the high touch surfaces are. Light switches, doorknobs, common spots on the door where people typically push to open a door. If there's printers or fax machines that get used frequently, that's on the high touch list. And then railings that could be around stairwells, that would be on a high touch list as well. And as I mentioned, posting occupancy limits on conference rooms is a good idea as well. We also recommend in these conference rooms where you don't have windows that can be opened, placing a small portable HEPA filter unit that will clean and scrub the air over time. So that's just an additional measure that can enhance ventilation. We talked about the staggered arrival and entry of employees to decrease the density in the workspace. When you're getting on elevators, you should be thoughtful and mindful of that, and maybe coming up with a list or a occupancy limit for elevators. Some organizations put markers in the elevators of where people should stand. Did you have something you wanted to add, Joan?
Yeah, I think just, you know, that top right one where we're talking about this kind of either or concept. There's a discussion about face shields, and if you want to comment on face shields, either or mask, or you've got thoughts on that?
Yeah. Yes. One thing we like to say when Joan was talking about the screen, the masking, the screening, the cleaning, the 6 feet in between, it's not one or the other. And this is a layered approach. So if you take away one of those, then you're increasing your risk. And we do recommend having masks on rather than face shields, because the masks seal better around your face, whereas a face shield is open on the sides and aerosols can escape around the sides.
And then you see that picture there of the face shield, and you see it's an and, so it's not the mask off and the face shield. You see, this is a situation where employees cannot physically distance, and so we have the mask and. So the mask and, when you can't physically distance, there's a mask and a face shield, a mask and some other protection in addition to that. So, and then the staggering of, there you see the lunch times, and as Melissa said, the arrival time. So if you have a large group of employees, better to stagger that entrance time. If you've only got, you know, if you a handful of employees, it's probably not as important. as it is if you have a large group. But the eating, again, where you've got your mask off, that would be ideal or better if you could stagger that and not have employees eating together, especially in a smaller facility, especially in smaller break rooms. And then lastly, that culture there, you see somebody is sick and they're at home, that culture of encouraging your employees to stay home. There's a lot of need, of course, for people to work and to be employed and to make money. If there isn't thought given around how you can encourage them to stay home when they're sick, you know, it's very helpful if you can create that culture to try to support them to stay home when they're sick. Next slide, please.
Okay, so this is some environmental considerations. So common work areas, we talked about elevators, break rooms. I know a lot of times you have coffee pots and water stations in break rooms. So you'll want to think about having disposable cups in those areas. I know a lot of people bring thermos mugs and you don't want people taking their cup that they've been drinking out of all day and then, you know, placing it on the edge of the coffee pot. So we encourage the use of disposable cups. I know it's not a green thing to do, but it would help prevent the spread. Restrooms is another common area. So we also recommend if you have multiple stalls in a restroom, marking off every other one. And the reason we do this is to limit the number of people that are in a restroom at one time. And the same with sinks, marking off every other sink so that you give space in between when people are washing their hands. And another thing about restrooms is having paper towels in the restrooms instead of the air dryers, because the air dryers can spread the aerosol. So if you can keep the door open to the restroom, that prevents people from having another touch surface. If you can't, then we recommend putting a trash can by the door so that employees and visitors can use a paper towel to open the door. And there's signage on hand washing that we could share, or you could also get from the CDC's website that we recommend to post in restrooms that show proper hand washing procedures. Other environmental controls are, well, they kind of go hand in hand with air filtration. So opening your outside air dampers on your HVAC units to let in as much fresh air as you can, opening up windows in meeting rooms and common spaces. The more outside air that you can get in, the better. And then regular cleaning. You want to establish a cleaning schedule and you want it to be visible for employees, because if they don't see it, they won't know that it's getting done and they won't feel safe. So establish a schedule like every 2 hours, and again, have that list of high touch surfaces. Deep cleaning, that's recommended to be done at least once a day, maybe at the end of the day, where you're cleaning other surfaces that are hard surfaces that are not high touch, like just tables, desks, things like that. And then if you're doing any vacuuming, we recommend that you don't do that when there's other people in the room. You should have a HEPA vacuum if you are doing it when other people are in the room. So air filtration in the mechanical sense, we recommend at minimum a MERV 13 filter. So some of the buildings may be older and you may not be able to add additional levels of filtration. But if you can, MERV 13 is the minimum that's recommended. And you want to have an HVAC expert look at your HVAC unit and make sure that the filters are seated correctly and that there's no gaps around the edges. If you can go higher than a MERV 13, that's great. But it does add pressure on the fan. So the higher up the filter you go, the more pressure is on the fan, and you don't want your HVAC system to break down. So you'll want to have an HVAC expert tell you what filter you can have on your unit. Next slide.
Can I follow up on a couple of those things that you talked about there? Just some of the things I've learned from you from working together in this when you have people cleaning your facilities, those high touch surfaces, a lot of companies that we talk to say, oh, we've got this cleaning company and they do it. Or, oh, we're having our whoever clean. But you're going to want to go through and look and see what they consider a high touch surface and make sure that it's consistent with what you think is a high touch surface. So there's high touch surfaces, and then there's also the high touch surfaces that are shared. So shared high touch surfaces certainly are areas that you want to clean frequently and understand how they're cleaning them. And also understand what products they're using to clean them. And Melissa certainly can talk more on this, but how they're using those cleaning products. Are they leaving them on for the appropriate amount of time that's recommended for COVID? And then also we're talking about cleaning so that customers can see you clean. So oftentimes we clean at night. Traditionally, we've tried to clean at night out of the eye of the customer. But customers want to see that someone's going through and cleaning those high touch surfaces. So is there the possibility to move some of your cleaning of those high touch surfaces to when your customers are in your organization? Thanks.
Yes, and the other thing I forgot to mention about air filtration is that a lot of times the air handling units are programmed to turn off at night, or sometimes go down to just no air conditioning, but it's to save energy. And I know that's another green thing that's going to be out the window here, but we recommend keeping your unit running at night so that it's continually cleaning the air and having those numbers of air exchanges in the environment. You don't have to have the air conditioning blasting or anything to keep it ice cold or anything, but you want to keep the unit cycling. Next slide. Okay, so as I mentioned, in elevators, if you can, put markers down on the floor and signage with occupancy limits to help remind people. I've learned that over time, people just become kind of complacent and they just think that, oh, I'm wearing a mask so I can come in this elevator. But again, it's not an either or, it's masking and 6 feet in between, or as much distance as you can get. Alternating chairs or taking away chairs. You can put stickers down on tables to identify where people can sit. That's another best practice that we've seen. In manufacturing, we've seen assembly lines where they've established shower curtain dividers in between, and then they'll have kind of like a dryer flex tube where they can hand equipment through a tube to the next person, so that they have that barrier between. Next slide.
And so this is just to kind of summarize what we've been doing and how we've been working in the community. And then again, if you have need for other services, but we have on our website the playbooks. We have other services that we offer. So around reviewing your plans, back to work plans, those kinds of things. COVID hotline access for questions around COVID from you or your employees. Entranceway screenings, and again, access to doctors or people to review your plans if you feel like you need something more in detail. But again, the big bulk of this work has been to really take the content and what we know and make our information free and available to the community through the playbooks that we are publishing and through the information on our website. I saw a couple questions in the chat. Melissa, can you talk about the thermometers and what type of thermometers people can
Sure.
use?
Yeah, the infrared thermometers are a good thermometer. They're pretty quick. They take about 3 seconds. Some places are using an app and having employees fill out like an attestation that says that they don't have any symptoms. They go through their questionnaire. They say that they take their temperature at home. But we recommend taking the temperature at work. We have at our main campus 4,000 employees going through screening every day, and it really doesn't take too long. It doesn't hold up, doesn't create congregation at the door. The other kinds out there, our digital ones take a little bit longer. There's some that are cameras, thermal cameras that we've seen in use, where you stand on a marker and someone's on the other end at a computer screen and they can see your temperature on the screen. Those are also pretty quick with the screening process. I did forget to mention that on the cleaning wipes, there's an EPA ID number on every bottle or canister of wipes. And there's a list N that the EPA has that you can look up and see if your product is approved by the EPA for use for COVID. And you'll want to pay attention to the manufacturer's instructions because they have various contact times. So one product may have 2 minutes that it has to be wet. Others may have 10 minutes. So you'll want to pay attention to those contact times, consider the effectiveness, and also consider the safety because some products may be very corrosive where you might need additional PPE to use it, such as gloves and eyewear to protect your eyes.
I don't know, Melissa, you wanted to comment as well. Like one of the common things that we're getting questions about is all of the products that are being sold to businesses, someone will say, oh, they come in and spray my business and it's COVID free for a year, all of those kinds of things. One, what your thoughts, and two, if you had to put your resources somewhere, where would it be?
Yeah, I would put my resources to the EPA list N products and HEPA filter units for cleaning the air. Yes, I've seen products out there that say spray this on a surface and it lasts for 24 hours. Well, that may be true for some bacteria that's really easy to kill, but it's not true for COVID. And there's also a lot of other products out there that make claims. So you just really want to ask whoever your sales person is it on EPA list N? UV light is another one that I get a lot of questions about. We've done studies at UH trying to disinfect PPE with UV light. And the tricky thing about UV light is that it has to come in contact with the surface for a certain amount of time. And if you are trying to disinfect a room and you have a UV light machine in a room, if there's a chair in the way, it might create a shadow, and so it may not hit every surface. So we don't recommend UV light. The areas where UV light can be helpful is if there's like no ventilation and you have like an upper airway UV light, which is a UV light that's up near the ceiling. So somebody asked if I could comment on the filters. Yes, MERV 13 filter was the minimum filter. And that's typically what we use in hospitals. That is the minimum of a MERV 13 all the way up to HEPA filters.
Then I saw in the chat as well, somebody asked about recommendations for restrooms, and we talked about closing off every other restroom, closing off every other sink. And the reason why you want to do that is to decrease the density of people in the restroom, so you don't have as many people in the restroom. And then Melissa also talked about the cleaning to make sure that you're using that whoever is cleaning the bathrooms is using the right cleaner and then has the right protection on as they use it. So if that's a job that you're giving to your own employees, to make sure that they have the right gloves if they need to, any other type of protection or ventilation while they use that type of cleaner, that's something that you want to be aware of.
Yeah,
And then
tip is that sometimes you'll get a salesperson that says, oh, you don't have to wipe this cleaning product down. You can just spray it on and leave it and walk away. But you have to keep in mind that disinfection occurs when you have a surface that is free from dirt and grime. So if you have dirt and grime on a surface, spraying something on there, it's not going to make that disappear, and the disinfectant won't work as well. So you have to make sure that the surface is free of that.
Great. So it looks like I don't see any more questions in the chat. If anyone wants to throw anything else in there, we have a few minutes, but I wanted to unless Dr. Zoltanski, if you have anything else, we've got some contact info here and just say thank you very much for coming on today to do this presentation. We will be sending out an email to everybody that attended and we've recorded this so we can post it on our website. Additionally, MidTown is working with Team NEO and Jobs Ohio to help distribute some PPE safety toolkits to help ensure small businesses are equipped with masks and hand sanitizer. So we actually got about 25 kits that contain 100 3-ply masks, 10 KN95 masks, and bottles of hand sanitizer. So if people are interested or businesses would like that are for free to give out, please send me an email or reply to after the webinar email. But just wanted to say.
Rich, one warning about the KN95s, that I just want to let you know that you should only use those just as a regular face mask. Don't wear it as an N95 and think that you're getting 95% protection. It's not the same as a NIOSH certified N95. And actually, I have sent some of those to a lab and found that the ones that I sent in, I sent 5 different brands in, and they were only 30% efficient. So, but you are okay to wear them just as a regular face mask.
Okay. Thank you for explaining that. So if people are interested in those, please send me an email or email back to our contact list. Let's see, does anyone else have any other questions for our panelists? Otherwise, thank you very much again to UH and to PNC for sponsoring this, and we're just very, very grateful and thankful for the work that you do. And hopefully this has been very informative to everyone watching.
And I would just say one other closing comment is that, all of these things that we're talking about, the masking, screening, the distancing, those types of things, those four layers, and the cleaning, of course, but to think about that, not only do you want to do it, but you want to do it so that your employees see it and your customers see it. We know within research in our own hospital system and many of the businesses, I've seen a lot of the questionnaires for customers, questionnaires for employees, that people want to see that businesses are taking these safety parameters seriously. So do it, and then also inform your people about what you're doing.
I saw another question regarding restrooms. Should they be cleaned after each use? No, that is not recommended. You don't have to do that after each use. Just establish a frequency. One site I was on said that the county had recommended to them after every 20 uses, but I would just go with a time frame of like once an hour or once every 2 hours.
Great. Okay. Well, if there's no other questions, again, thank you very much. We really appreciate it. And again, thanks for everyone for joining.
Sure,
Thank
thank you.